Monday, June 22. This is the news on PBCJ. I'm Carol Francis. As of Monday morning, Jamaica has seen a record number of recoveries. 54 more patients have recovered and been released from isolation. There are now 133 active COVID-19 cases under observation. The latest confirmed cases are 2 men aged 39 and 40 who arrived from the United States. The total number of confirmed cases now stands at 659. Approximately 300 Jamaican ship workers arrived in Port Royal on Saturday, June 20. They were all processed using the established protocols for testing, sensitization, and quarantine as would have obtained for all previous ship arrivals, including mandatory state quarantine until their test results are available.
Just over 300 Jamaican ship workers disembarked Royal Caribbean's Rhapsody of the Sea and the Disney Wonder on Saturday. Minister without portfolio in the Ministry of National Security, Senator Matthew Samuda, was on location and noted the swift disembarkation process. The workers were granted entry into the island through the government's controlled re-entry program. Labeling their efforts as Herculean, Senator Samuda praised the efforts of the multiple agencies on location.
The personnel here is a multi-agency effort, right? So I mean, you have the usual travel process as facilitated by PICA and Customs is underway, but then you have a Herculean effort from the team from the JDF, the team from the Public Health Department of the Ministry of Health. You have JDF, JCF, Port Security. You have supporting cast from JUTC, you have the Port Authority. You know, it's a Herculean effort to really ensure that health protocols are adhered to. So, you know, we're happy with the effort so far, and we really appreciate the team.
Mr. Samuda says the swift processing period is as a result of previous experience.
Well, you know, practice makes perfect, right? So this is one of several sets that you've managed to process. So we have gotten better, but the improvements are also based on the improvements in the very system. So we've invested in automating much of the process. So a lot of the questions and answers come before persons come. So when they come, it's more verification as opposed to data entry, which makes a huge difference. Parts of it also, as it relates to geofencing, in cases like this where persons will be with government quarantine for a day or two as they wait their results, we can take our time to do the geofencing part of the space rather than have them wait here for that. So you've learned lessons, certainly from the first sets, and we're happy with the process so far.
And acknowledging issues with previous efforts to repatriate Jamaicans, Mr. Samuda outlined steps being taken to avoid any repetition of this.
Look, you're dealing with thousands of persons returning to Jamaica with new processes that didn't exist 2 months ago. You are going to have some issues. There's no new system that is ever implemented without some issues. What I'd say is those issues are behind us. What we continue to do is to review the process virtually every single day with the teams from all the agencies I would have listed previously. And we continue to improve on the systems. Now, even with the persons who have had data issues on their phones, for the ones that we geofence, both Flow and Digicel have come in and have offered supporting packages to help persons for the 14-day period. So, you know, it's private-public, but generally I think we're getting much better at it. And we have to get better at it because Jamaica depends on travel. And these processes are a part of the new normal.
And healthcare workers were on location to explain the process fully.
For 14 days, Canada. Means that you're not going to go through the gate. You can walk up and down anywhere you want and you come down because that's where you live. But not through the gate. If you need something at the stores, ask somebody to get it for you. Don't entertain anybody for those 14 days. Because we do not want, because at the end of the 14 days, you will be tested again. And we want to make sure that everything is okay before they go up and they kiss up and all of those things start taking place. Because when you leave here today, everybody going to a government facility. If the results are positive, you are going to be remaining in the government facility and you are going to be given treatment and you will not be allowed to go home until after you have got 2 negative test results. You have to keep in mind that some person's body will respond faster to the medication than some other person.
For the news on PBCJ, I'm Gabrielle Thompson.
Since Jamaica's borders reopened to international travel on June 15, the island has averaged 10 flights a day. So says Senator Matthew Samuda during the last sitting of the Senate. Simone Absalom has more in this report.
Senator Samuda says the process at all ports of entry, sea or air, is the same for all persons entering Jamaica, resident or non-resident, except for persons coming from countries which have been designated as part of the travel bubble. The countries in this bubble are the ones that the Health Ministry has assessed to cause very little risk, as they have little to no spread or generally very low case numbers of COVID-19.
You land or dock at the port. Persons disembark and are greeted first by a team from the Ministry of Health and Wellness, which conducts the first health screening. At this screening, they take their temperatures and confirm the person's name and information. You then proceed to the second and more in-depth health screening before you enter the immigration hall or on the or as a section of the immigration hall, depending on which port you look at. And you go into your more in-depth health screening, which confirms the information entered on your travel application and allows health professionals to complete risk assessment. At this stage, persons are given their orders to be signed, which are deemed appropriate to the risk that has been assessed. So basically they're determined whether they get government quarantine, home quarantine, stay at home, intended address, or stay in zone. Persons from countries outside of the travel bubble proceed to where they're sampled for testing, which is also before you go to PICA. Once sampled, this group proceeds to immigration and then customs, as we would all be accustomed to. Once landed and cleared by customs, the monitoring process commences based on the order that would have been given to them by the MOH team. It is at this step where persons are registered either on their phone or with bands are registered on the system to be tracked.
The COVID-19 pandemic forced the Jamaican government to put in place procedures and a system that will allow controlled re-entry of Jamaican citizens, as well as the entry of non-nationals. The measures allow the Ministry of Health and Wellness to monitor for the period of 14 days and longer, if necessary, all returning residents. Senator Samuda says monitoring is done at a command center set up at the Commissioner of Police's office.
In the few cases where there has been difficulty, largely because of limited coverage of data through our telecom providers, we've asked the officers in the nearest station and the public health officers to provide physical checks to confirm persons are adhering to their quarantine orders. Persons who have completed their process are cleared from the system and tracking ceases. So there is a countdown in the system, colleagues, where at the end of 14 days, unless there is a request from the Ministry of Health to extend the order because of something that would have happened, you automatically come out of the system.
Mr. Samuda says 19,312 applications from residents have been reviewed through the JAM COVID portal and just over 2,700 from non-residents through the Visit Jamaica portal.
We have asked the Port Authority and the Ministry of Foreign Affairs and Foreign Trade to compare the lists of persons who are still at sea, who have asked to come home, and the engagements continue with ship owners to make the arrangements for their return.
He says members of the Senate should be proud of the work of the member agencies to the task force, who contend daily with the challenges with the new normal brought by COVID-19 pandemic.
The Princess Margaret Hospital in St. Thomas has reportedly implemented a number of changes to deal with the coronavirus COVID-19 pandemic and stands ready to continue to deliver high-quality healthcare to its clients. Among the changes at the hospital, which is the only secondary healthcare facility in the parish, is the retrofitting of some areas and scaling back of some services. The Chief Executive Officer of the Type C Health Facility, Melissa Linton, says the Accident and Emergency Department has been renovated and expanded, thus reducing the wait time and increasing the efficiency in the delivery of clinical care. Monday, June 22, has been designated a day of mourning in the Jamaica Constabulary Force for Constable Dakota Hilton and Corporal Dane Biggs. The two officers were killed in the line of duty on Friday, June 12. The killing of the 2 cops and injuring of 2 others in Horizon Park, St. Catherine is the worst attack against members of these security forces in recent times. Monday, June 22 will also be used to honor the 194 officers killed in the course of their duties over the last 2 decades. Writing the force orders on the weekend, Commissioner of Police Major General Anthony Anderson indicated that the JCF flag will be flown at half-mast from 6 in the morning to 6 in the evening. Moments of silence, the wearing of black by non-uniform personnel and strips of black by those in uniform are being encouraged during the period. The Denham Town Primary and Infant School is to be renamed the Edward Seaga Primary and Infant School. This was disclosed by Minister of Local Government and Community Development Desmond McKenzie during a memorial service for the late former Prime Minister Edward Seaga at the City Mission Church in Kingston on Sunday.
We are expecting in August of this year to continue our support to students going back to school. We are expecting in August this year to rename officially before the beginning of a new academic school year, the Denham Town Primary and Infant School to be renamed the Edward Seaga Primary and Infant School in August of this year.
Mr. McKenzie also said more than $10 million will be spent over the next 3 years to meet the financial obligations of 6 recipients of the Edward Seaga Scholarship Fund, which was launched last year.
This year, it was brought to our attention that in the middle of West Kingston lies super talent in education. And there is one young lady who was fortunate to gain a scholarship to the prestigious Long Island University, the Brooklyn campus, to do a degree, an undergrad degree in chemistry with the intention to go on to become a neurosurgeon. The cost of her tuition is rough. And she got a portion of the scholarship from the university. And she has been trying on her own to raise the balance of $27,000 to fulfill her dream. Well, today, I am proud to announce that the Edward Seaga Scholarship will provide the $27,000 to ensure that her dream becomes a reality.
The Most Honorable Edward Seaga, Jamaica's 3rd Prime Minister, died on May 28, 2019. He was 89 years of age. And time now for today's business and market news, data and analysis from Gabriel Thompson.
In Friday's trading session, the JSE combined index declined by 5,699 points to close at under 400,000 units. Overall market activity resulted from trading in 70 stocks, of which 31 advanced, 23 declined, and 16 traded firm. The junior market index advanced by 18 points to close at under 3,000 units. Stocks advanced for 1834 Investments Limited, Cargo Handlers Limited, and Caribbean Cement Company. Stocks declined for 138 Student Living Jamaica, Barita Investments, and Berger Paints Jamaica. Trading firm were AMG Packaging and Paper, Blue Park Group, and Carreras Limited. JMMB Group Limited was the volume leader with 3.9 million units, followed by Wigton Wind Farm Limited ordinary shares with 2.8 million units and Proven Investments Limited with 2.1 million units. Now for the foreign exchange. The US dollar on Friday, June 19, ended trading at $140.54. The Canadian dollar sold for an average $105.61. The pound sterling traded for $177.19, and the euro ended trading at $160.74. Oil prices fell on Monday as concern grew that a record rise in global coronavirus infections could stall recovery in fuel demand, outweighing tighter supplies from major producers. Brent crude futures fell 24 cents to $41.95 a barrel. West Texas Intermediate crude futures fell 25 cents to settle at $39.58 a barrel. And that's it for the business report on PBCJ. I'm Gabrielle Thompson.
The JN Foundation is inviting members of the public to submit entries to its JN Resolution Project COVID-19 Jamaica Photography Competition. The competition provides an opportunity for Jamaicans at home and in the diaspora to tell their own coronavirus-related stories through the lens of their camera. Persons are invited to submit photos under the following themes: mosque, health and fashion, changing traditions, Tan Ayuyad, essential workers, the hustle, and acts of kindness. The winning photos will be awarded 100,000 Jamaican dollars for first place, $70,000 for second place, and $50,000 for third place. Submission should be made by July 31 of this year. In regional news, the air quality index has registered unhealthy in Trinidad and hazardous in Tobago. Meteorologist says thick dust from Africa arriving across the Eastern Caribbean will affect the Twin Island Republic for several days. We get more in this TTT News report.
The Environmental Management Authority says at 11 a.m. on Sunday, its monitoring station in Point Lisas registered an unhealthy air quality index, and at Signal Hill, it was hazardous. The Air Quality Index is a number used by government agencies to communicate to the public how polluted the air currently is or how polluted it is forecast to become. As the index increases, an increasingly large percentage of the population is likely to experience severe adverse health effects. Now, in terms of the unhealthy status at Point Lisas, the authority says expect increased aggravation of respiratory symptoms in sensitive groups, including older adults, children, and people with respiratory ailments and allergies, increased aggravation of heart or lung disease and premature mortality in people with heart or lung disease, increased respiratory effects in the general population. Now, people with heart or lung disease, older adults, children, and people with respiratory ailments and allergies should avoid prolonged or heavy exertion, and everyone else should reduce prolonged or heavy exertion. It is recommended that in Tobago, where the status is hazardous, everyone should avoid all physical activity outdoors. People with heart or lung disease, older adults, children, and people with respiratory ailments and allergies should remain indoors and keep activity levels low. Now, TDT's meteorologist Ian Wallace tells us we can expect the thick dust from Africa to stay with us for several days.
Strong thunderstorms over Africa create these massive dust storms. These massive dust storms, with some events reaching very high volumes of dust, can reach the Atlantic Ocean if the pressure patterns and winds are favorable. A mass of very dry, dusty air is called the Saharan air layer, and it forms over the Sahara Desert from April to August and can travel over the tropical North Atlantic Ocean every 3 to 5 days.
He says animals such as poultry and coral may also be affected by the high concentration of Saharan dust. Health professionals are advising affected persons to seek medical attention if they experience severe shortness of breath or difficulty breathing, persistent fever for more than 2 to 3 days, or a severe worsening of a pre-existing condition.
The mayor of Castries in St. Lucia, Peterson Francis, is denying allegations that the CCC has deliberately neglected the upkeep and sanitization of the comfort station. We get the details in this story from HDS News Force.
According to Mayor of Castries, Peterson Francis, there is no malicious intent in the closure of the Comfort Station located in the George Charles Boulevard. The Mayor of Castries says the facility had steadily declined due to staff discomfort with servicing the station located in what has been described as a rough neighborhood. Francis believes the concept of a comfort station was misguided and robs residents of their dignity.
It's degrading. You know what I mean? You can't do better, yes. But it's degrading for you to live in your home, go into a facility, everybody's seeing you, have your children, you have it, and what time of the night you could go there. So it's a very, very, very ticklish situation. But we're not victimizing anybody. We're not trying to make anybody lose their seat. It's not we. I don't vote. It's these people.
Francis dismissed the notion of political mischief on his part, claiming, like the leader of the opposition, he too wants a functional comfort station for residents. The mayor claims the employees who manned the facility were from the community and environs.
It's not something we're trying to penalize, as I heard in Parliament, as I say they're trying to penalize to the extent that they want him to lose his seat. No, I've been very cooperative with the leader of the opposition, and he could attest to that. And I would love to have the facility open, but we cannot have the facility under this condition. But see, the amazing thing is this. Did the leader of opposition, at any time, knowing full well what the situation is, approach his people, try to tell them why he put that facility there for them and what's the use of that facility? What did he do? But now you're complaining that he's been, victimized. But he could have gone to his people, talked to his people, they know him very well, they vote for him all the time. So he had full control over them. What did he do?
Will the historically disenfranchised and underserved community receive an operational comfort station?
Well, the leader of the opposition have to work with us to see whether we could get some middle road as far as that is concerned. We are willing, but we cannot have people. We have, how many security people that are afraid to even go inside of there? You should know that. Okay? But I have not heard of people complaining that they need the facility so badly that it needed to open. Nobody's complaining.
The mayor argues that a household with a working bathroom is more ideal than a community facility that cannot afford people dignity and privacy.
When we are politicians, we always say it's very easy, especially when we're in opposition, that we're always going to uplift the people. We go have them at their dignity. But when we're in power, we degrade them.
Some residents told Newsforce that they now see the George Charles Comfort Station as nothing more than a hollow shell that laughs in the face of people viewed in some circles as being at the bottom of the totem pole. Solange Alfred, HTS Newsforce.
The Barbados government is considering a combination of face-to-face teaching and virtual classes when secondary and primary schools reopen in September. We have more in this report from Barbados Today.
Word of this from Education Minister Cynthia Bradshaw, who on Friday acknowledged that it will be difficult to enforce physical distancing regulations with a full reopening of classes. She was speaking to reporters after receiving 160 tablets from the Capital Kids Project and the Amaron Trust. She says discussions with teachers' unions and other stakeholders are ongoing.
Trying to get the entire school population back into the school plant will present challenges given the current restrictions. And therefore, we have been looking at, whether it's staggered times, whether it is staggered classes coming back in or form levels coming back in. I think what we want to do first, though, is to assess how these 4 weeks work. Because having, say, 100 students per primary school presently in the school environment, I think it is about assessing at the end of this period as well, what were the challenges and how, with additional numbers, how are we going to be able to cope.
Sports in Jamaica came to a standstill in March with the suspension, postponement and cancellation of major events such as the Easter Grace Kennedy Boys and Girls Athletics Championships and the 2019-2020 Red Start Premier League season. Jamaica's Sports Minister Olivia Grange says the process for the resumption of competitive sports in the island has started. According to Ms. Grange, practice sessions have been authorized for track and field athletes. She added that guidelines will be issued to allow the resumption of training at the National Aquatic Centre. Recovering West Indies cricketer Craig Brathwaite says he has turned to former captain and coach Desmond Haynes for advice on improving his form.
Me and him always had a good relationship. Because he was team manager for the Barbados team when I first started. So, he had some chats with him. He's obviously open as well. And, it was very beneficial to me. It's a lot about just keeping it simple. You don't really want to complicate it too much. But, yeah, Desmond Haynes.
Brathwaite was one of the heroes of the shock win at Headingley in 2017 with scores of 134 and 95. The Barbadian cricketer bats right-handed and occasionally bowls right arm off break. He says he is ready to put Desmond Haynes' advice to good use in Test cricket.
No, I don't think, changing, what's worked for me so far, obviously, is patience. And obviously, how to develop, some shots, over time. But I think generally, patience, spending time is very crucial in Test cricket, spending time at the wicket for any batsman. So, that worked for me. And, in between, just had to groove some shots, improve on, different technical stuff. Regarding, Desmond Haynes, it's just simple advice. Sometimes it's just about what he did, back in the day, when he was in the field for a long period, how he would go about getting himself worked up, the first 3 overs in a day, 3 overs left in the day is always a tough period for opener or, hour. So it's just mental stuff, that he helped me with. I won't say, technical. Me and him worked on some shots before, before probably a couple of years ago. But, it's all mental, in Test cricket. And, once you get your mind strong enough, I think that's how he dealt with it. He's very strong mentally.
And that's our package. Join us again tomorrow, same time, same place, for more news and sports right here on PBCJ, the People's Station.